Those of you on Medicare who have enrolled in a Medicare Advantage plan, make sure the person who's helping you enroll has explained to you how a Medicare Advantage plan works. Because I can't tell you how often I talk to people and they do not have an understanding of it, which I understand because it's confusing. But I talked to somebody today and their parent is in a Medicare Advantage plan. And of course, it wasn't up to them to have an understanding how it works. It was up to the parent. But the fact is that whether it's you or your kids, whoever it is, you gotta understand it. So when you start with the premise that you have a $0 monthly premium, which is often typically the case, by the way, you're still paying Part B, the $174.70, but you're in an Advantage plan. You have a zero premium, but what you have is something called a MOOP. That stands for the max out of pocket that you could spend on a plan. With that MOOP, let's say they defined it as $4,000. In every zip code, every plan, it's going to be a different amount. But let's say, again, you're in one for $4,000 and you have a 3-night hospital stay. Here's what happens. In exchange for the $0 monthly premium, you are going to pay copays and coinsurance up to that max, that MOOP, that max out of pocket. So if you had a 3-night hospital stay and your plan defined the copay for each night in the hospital as $300 copay, after that 3-night stay, you're going to owe $900 towards the MOOP. So now the MOOP, instead of being $4,000, there's $3,100 left. The MOOP resets January 1st. So that is a calendar year that is defining the amount that you could spend. Also know that that MOOP does not include your drug copays. Your drug copays is in addition to the max out of pocket. So when I got this call and the person was confused, why is my dad being charged all this money? That is why, because of this max out of pocket you can spend. And don't forget this fact. A max out of pocket is something different than a deductible. A deductible is something you owe up front before the plan's going to start to pay. The max has nothing to do with that. The max is the most you can spend. So if you're in the hospital and there is a $20,000 bill, but the plan defined it as $300 a night, you don't have to meet the deductible first. You're going to pay $300 a night, that $900 that I mentioned. So please, whoever is helping you, have them take the time, insist that they take the time and explain to you how these plans work so there are no surprises down the line if you or a loved one is in the position where they need medical care and they are not aware that there are going to be costs that come with it.